Today I'm going to share some information with you about strokes. Strokes are one of the leading causes of death and disability in the United States, and as a paramedic and an emergency room nurse, strokes are a common medical emergency that I encounter almost every day. We're going to talk about the different kinds of strokes, what causes a stroke, the early detection, signs and symptoms of a stroke, and the treatment of a stroke. First, we'll start off by talking about the kinds of strokes. There are two separate kinds of strokes: a hemorrhagic stroke and an ischemic stroke. In a hemorrhagic stroke, you have a blood vessel in your brain that begins to bleed out into the brain cavity inside your skull. It can be caused from trauma, from a car wreck or a blunt force injury. It can also be caused by just simply aging in a weak spot in a blood vessel. This kind of stroke usually requires surgery and will make you fly out to Springfield or Little Rock. The kind of stroke that we're actually going to spend most of our time on today is an ischemic stroke. This stroke is caused by a blood clot in the brain, be it plaque or a blood clot, or it can even be an air embolism. The treatment for this within a time window is an IV drug known as TPA. It is a clot-busting agent. It's very effective. And we're going to talk about the early detection signs so we can get to that. That is our goal. We want TPA if we're having a stroke. Hemorrhagic and ischemic strokes both display the same. Signs and symptoms will be blurred vision, facial droop, slurred speech, dizziness, confusion, weakness to one side or the other. This can happen instantaneously, and these are the symptoms that you really need to key on, because the quicker you determine that somebody's having a stroke, whether it's you yourself or a loved family member, you have to act. You see those signs and symptoms, you call 911 immediately. TPA for the ischemic stroke, which is what we're going to hope you're having if you're having a stroke, because the prognosis is much better, has a 3 to 4 hour window. So living in Mountain Home, which is a pretty rural area, lots of us live, say the far end of Baxter County in Norfolk or Jordan, or in Marion County in Yellville or Summit or Lakeway, those kind of areas. You think about how long it takes an ambulance or a helicopter to get to your house when you call 911. You think about how long it takes you to get from your house to the hospital. When you first get to the hospital and you're exhibiting signs and symptoms of a stroke, you have to go to a CAT scan. That can determine if you're having an ischemic stroke or a hemorrhagic stroke, which is the bleeding that we talked about. If the CAT scan shows blood in your brain, you're off to see a neurologist and for brain surgery if it's bad enough or if they feel like you can survive the surgery. The clot stroke, that's the good stroke. That's where we get to the TPA drug we're talking about. 3 to 4 hour window for that. So you have to identify those symptoms so quickly. Blurred vision, confusion, weakness to one side or the other, facial droop, slurred speech. Those are the things we have to focus on, and those are the things we have to recognize very, very quickly. Those are the things that you can possibly have a good outcome. There are some side effects to the TPA, hemorrhage. It's not a fail-safe drug by any means. If you have a history of ulcers, GI problems, if you take Coumadin or warfarin, if you have any sort of other bleeding disorders, you probably can't take TPA. But I'm telling you, it is amazing if you do meet the criteria, because I've seen people come in that are completely disoriented, full-blown strokes, completely flaccid on one side, can't speak, can't look at you, can't focus on you, can't answer any questions, and I've seen their symptoms completely resolve in minutes. You would not believe how effective this drug is. It is absolutely unbelievable. But once again, we absolutely have to recognize these signs and symptoms early of a stroke. That's the only way to get this drug, and that's the only way to improve our prognosis. Remember, blurred vision, slurred speech, weakness to one side or the other, dizziness or confusion. They can all happen very quickly, and a lot of those things can mimic other signs and symptoms of something less severe, but we always want to err on the side of caution because we have a 3 to 4 hour window. So that's just a little advancement in the last couple of years with this drug, and the prognosis of strokes have really improved because of it. So just remember the importance of detecting it early, and that the outcome can be much better than you think. Thank you.